I was having symptoms, it's really fascinating, I was having symptoms of hypothyroidism. That means low thyroid. Yet my blood work, according to Western medicine, was fine. I carried around with me a prescription for thyroid medication, and I hadn't filled it. And then I ran into Dr. Furno at a conference, and I said, I'm going to try nutrition response testing and see if that will help my thyroid. And indeed it did. The symptoms have totally disappeared. It feels like a miracle, actually. And without any medication. I take supplements, and I feel that unlike Western medicine, when we give thyroid medication like Synthroid or even Armour Thyroid, we're just correcting, we're just putting in thyroid hormone to make us feel. But when I go to Dr. Furno, he is giving me supplements that are actually correcting the problem that is causing me to have the symptoms of hypothyroidism. Now, Dr. Furno, if you have several people who have the same symptoms, would you treat them all the same?
No, and that's the beauty of nutrition response testing. You can have 3 or 4 people that are coming in with the exact same symptoms or the exact same conditions, but they actually have different underlying causes or barriers that are causing these problems to occur. So their treatment plans would be very, very different. We can go even a step further, and we can have 2 patients that have the exact same cause of the problem, but yet their treatment plan, depending upon what their body needs specifically, would be very different also. So the beauty of it is it's custom tailored for you, the individual, exactly what you need, how much you need, and we can progress that way.
And what's also noteworthy is the body may say that it wants certain nutrients at this point in time, but you come back a couple of weeks later and the body has now changed and changed its mind and now wants different supplements or a smaller amount of supplements. Dr. Furno is able to do testing not only for what nutrients are right for you, but how much of that nutrient your body is asking.
Yeah, you know, in the past, a lot of practitioners, even using standard processed products, they were using a large amount of products to try and feed the body. So through nutritional response testing, we're actually able to bring it down to the bare minimum of products that you need at the minimum pill count that you need in order to supply the body with what it needs. And one of the beauties with the standard processed products is that they're very affordable.
Yes. And as a holistic practitioner, I have, as I've grown in my studies of holistic medicine, I used to recommend certain products because I read a lot about the literature, and I have totally changed at this point where I no longer have confidence to tell people what supplements they should be taking. At this point, I feel the best way to know what supplements you need is to go to Dr. Furno or someone else who does nutrition response testing and ask your body, what do you need? And that your body's requirements change regularly, so I keep on going very regularly to Dr. Furno because I personally, I'm on a quest to be a healthy old person. That is my life's goal. I want to be 100 years old, and I want to be playing tennis. And I think it's very possible. And the way I am moving in this direction to attain optimal health, I feel it's likely to happen. My own personal story is that I lost 30 pounds, and because I always had a weight problem, and I healed up numerous medical problems. And I am constantly on the search to find good ways of attaining optimal health. Dr. Furno, how do you determine what the body needs?
Well, we do that through the muscle testing, as we were saying before.
And is that different than kinesiology?
Yes, kinesiology uses muscle testing also. What we're doing is not kinesiology. It kind of goes beyond that. Matter of fact, a lot of the advanced clinically trained practitioners, there's only about 300 of us in the country at this point, came from applied kinesiology background. And what was happening was they weren't getting the results that they wanted to get on a nutritional basis. So they were looking for something else and found nutritional response testing. I had no actual kinesiological background in the beginning in my practice, though.
And how long does it take for someone to start to feel better?
It depends upon the individual. Some patients start feeling better almost immediately. Others, it may be months before they really start noticing some changes. I know in your case, you started to notice some changes a little bit in the beginning, but it was really more on the months aspect.
Yes.
You know, it depends upon what your current state is. You know, it's taken years to get into the current state that you're currently in, or your health status now. Basically, however old you are, that's how many years this has been accumulating. But the good news is it doesn't usually take years and years to come out of that. It can happen in a very quick state within a matter of a year or two if somebody's really, really deficient and has some major problems. The main thing is what we want to do is ultimately get you onto a maintenance type program, which we're starting to come into with your program now, just to keep you healthy. It's a fact that it's a lot cheaper to keep the body healthy and functioning than it is to let it deteriorate further and further. And as you were saying before, as we get older and older, our bodies do start deteriorating and breaking down. And if we can maintain it now and stay at a healthy level, then we're going to do much better as far as playing tennis and whatnot into our golden years. If you look at things like, it was last year on MSNBC.com, they had an article that came out that said that 40% of the bankruptcies in this country were because of health bills. And the scary part is that those people had insurance. So it costs a lot more to be sick than it does to be healthy.
Do you have any parting words?
Yeah, I'd just like to say that, you know, people have to have an open mind to try different approaches to their health care and for these long-term chronic conditions that have been going on. If a patient is not a nutrition patient, then it's unlikely that nutrition response testing is really going to help them. However, if they are a nutrition patient, then in my opinion and my experience, nothing works better. What happens is we need to start transitioning back to eating food again. You know, since 1918 they started bleaching flour in this country, and in essence we've been poisoning ourselves ever since. We mostly eat products, very rarely, if you start thinking about what you've eaten for the past 2 or 3 days, how much of that was fresh vegetables or good quality meats. Most of it came boxed, or most of it came in a fast food restaurant. You know, if you're stopping at your local drive-through, they're not really concerned about the quality of the product that they're giving you. They're looking more for the cheapest form to give you just to kind of feed the masses. But we've seen over the decades how the overall health status of the country is just declining continuously. We're getting more of these autoimmune type diseases and whatnot. And it becomes a scary thing, because back in the 40s and the 30s, the founder of Standard Process, Royal Lee, made a statement about how we are treating chemically the effects of malnutrition. And, you know, they've known this for 50, 60 years, but we continue on that path because it's easier, it's more profitable, shelf lives are more stable and whatnot. So really you want to get back into a community-based type program where you're eating local foods.
So I want to welcome everyone to join us on September 28th for CAM Group, and Dr. Furno will be doing a demonstration on how nutrition response testing works. Until then, thank you.
Thank you. Thanks for having me.
My pleasure.